for cosmetic surgery, all of this is elective, right? And so our goal as your plastic surgeon is to just make sure that we minimize as many risks as we can and complications, and that you just have the best outcome.
Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. We are just answering some of your specific questions. So thank you so much to everyone who followed along and comments. We're answering some of the questions that we're finding in the comments. So one of the specific questions that was asked was, how do we handle hormones around surgery? When do we stop them? What can we continue? What can we not continue? And Smita, as always, you and I are kind of united on how we feel about this, right?
Always. Yep,
always.
Right on the same page.
So what do you tell people? Like, the most basic thing that people are on is birth control, right? So what do you do when your female patients are on birth control?
Yeah. So in general, I tell them to stop for about 30 days, right? So that's 1 month.
Yep, exactly.
And the main reason is, right, hormones can increase our risk of getting blood clots. And so, especially with anesthesia. So we want to sort of control for and minimize all of those risk factors that we can, and one of them being birth control. So, you'll have to use other methods, but birth control you should definitely stop.
Yeah, I mean, it's a tiny risk, but we're just being extra cautious. So, just to stop it for a month really does reduce that rate. And so for us, absolutely worth it. And, we have lots of patients who are on hormones for other reasons. So whether they're, transitioning, or patients who are on hormone replacement therapy, we're just encountering more and more patients who are taking other hormones, bioidentical hormones. And I'm kind of a little bit more lenient with this, but I do a full 2 weeks. So 2 weeks before surgery and 2 weeks after, which is a full month off of those. And again, it's all those same risk factors that we're worried about blood clots, and we're just going to be extra careful to do everything we can to reduce your risk of complications. Is that pretty similar to what you do?
Yep, exactly the same.
Yeah. I mean, and we even do this in our cancer patients, when we're doing breast cancer, we'll stop some of those hormones 2 weeks before and 2 weeks after for blood clot reasons. So it's, in my mind, it's pretty similar, right?
I agree. I mean, listen, for cosmetic surgery, all of this is elective, right? And so our goal as your plastic surgeon is to just make sure that we minimize as many risks as we can and complications, and that you just have the best outcome. So things like hormone replacement therapy, other hormones for transitioning, birth control pills, all of those things are, just something small that we can do that will just really sort of improve your outcome.
Yeah, and all we want to do is make this as safe and amazing an experience as possible. So a quick little answer, but now you know. But please talk to your doctor, because I'm sure that there's some variations here, and some medications are a little bit more specific or different. But we definitely want you to stop your hormones just so that you're safe for surgery.
Absolutely.
Awesome. Well, thank you for the question.
Guys.
We're happy to answer it. Please send us more, and we'll see you guys on the next episode.
Absolutely. Bye, guys. See
Bye.
you next week.